We will now move on to genetic collagen disorders. There are many of these inherited disorders of collagen which encompass several different diseases, many of which cause hypermobility. The following are the ones that we should try to remember. The first is Marfan syndrome. Clinical features include long limbs, pectus excavatum, where the sternum dips inward, aortic aneurysm or dissection, ectopia lentis, the lens is displaced upward, aortic and mitral valve problems, wrist sign, where the surrounding the wrist with a grip, the thumbs overlap the little finger, and the thumb sign, the thumb inside the fist is not completely covered. An important screening test to monitor for Marfan syndrome is a yearly echocardiogram to monitor the heart valves and the aorta. Next is Ehlers-Danlos syndrome. This disease has variable skin hyperelasticity and joint hypermobility. Hypermobility is defined by the Baton score, which includes hyperextension of the fingers, elbows, and knees, and the ability to touch palms to the floor with knees extended. An EDS diagnosis is made when 2 major, 1 major, and 2 minor, or 4 minor criteria are met, which include major criteria of a Baton score of greater than or equal to 4, or arthralgias greater than 3 months in greater than or equal to 4 joints. Minor criteria include a Baton score of greater than or equal to 1, arthralgias greater than or equal to 3 months in greater than or equal to 1 joint or back pain, dislocation or subluxation of a joint, greater than or equal to 3 overuse injuries involving tenosynovitis or bursitis, Marfanoid features, abnormal skin, eyes such as drooping lids or myopia, or varicose veins, rectal or uterine prolapse. Next is osteogenesis imperfecta, which is due to defects in pro-collagen genes. Features include osteoporosis, multiple bone fractures, varying degrees of blue sclera, lucent, brittle teeth, and hearing loss. Of note, osteogenesis imperfecta presents with normal calcium, phosphate, alkaline phosphatase, and vitamin D levels. And lastly is pseudoxanthoma elasticum, which is an autosomal recessive disease and involves easy bruising of the skin, blood vessel issues, and eye issues. The main issue with these patients is recurrent upper GI bleeds because the elastic media of blood vessels is affected. Classic findings here include a cobblestone appearance of the skin with yellow papules and plaques resembling plucked chicken skin on the neck and in the axillae, and angioid streaks on fundoscopic exam.